Most seniors are told the same thing: magnesium is good for you. It helps with sleep, it supports muscles, it may ease cramps, it can even support heart rhythm. So naturally, many adults over 60 or start taking it without a second thought. But here's what almost no one explains clearly: not all magnesium is the same. And after 65, especially after choosing the wrong form, can lead to digestive distress, medication interactions, blood pressure drops, irregular heartbeat concerns, or even kidney strain in vulnerable individuals. Pharmacists rarely have the time to break this down in detail. Doctors often just say, take magnesium without specifying which type. In supplement bottles, they use complicated names most people don't understand: magnesium oxide, magnesium citrate, magnesium sulfate, magnesium aspartate, magnesium carbonate. They all sound similar. They are not. Some forms are poorly absorbed and mainly act as strong laxatives. Others may interfere with certain medications seniors commonly take for blood pressure, diabetes, or heart conditions. A few forms can accumulate in the body if kidney function is reduced, something that becomes more common with age. And here's the scary part: many seniors are taking magnesium daily without knowing whether their body can properly process it. Fatigue, loose stools, dizziness, muscle weakness, confusion. These symptoms are often blamed on just getting older, but sometimes they are linked to the wrong supplement choice. This isn't about fear. It's about clarity. Magnesium can absolutely be helpful when chosen wisely and taken appropriately, but blindly picking the cheapest bottle at the store or copying what someone else takes can create unnecessary risk. In this video, we're going to calmly break down 5 magnesium forms seniors should approach with caution. We'll explain why certain types may not be ideal after 60 or how they behave differently in the body, and what safer alternatives often look like. One of the most commonly purchased magnesium supplements on store shelves is magnesium oxide. It is inexpensive, widely available, and often included in multivitamins marketed to seniors. On paper, it looks impressive because the label shows a high number of milligrams per tablet. Many people assume that a higher number means better effectiveness, but what the label does not clearly explain is bioavailability, how much of that magnesium your body can actually absorb and use. Magnesium oxide has relatively low absorption compared to several other forms. A significant portion passes through the digestive tract without being absorbed into the bloodstream. Instead of supporting muscles, nerves, or heart rhythm effectively, it tends to remain in the intestines. That is why it is frequently used as a laxative. For some individuals, especially seniors with occasional constipation, that effect may seem helpful at first. However, when taken daily without careful monitoring, it can cause loose stools, dehydration, and electrolyte imbalance. After 65 or the body becomes more sensitive to fluid shifts. Even mild dehydration can contribute to dizziness, fatigue, low blood pressure, and confusion. If magnesium oxide is causing frequent bowel movements, it may quietly increase the risk of these symptoms. In older adults, dehydration is not always obvious. It may present as weakness, lightheadedness upon standing, or subtle changes in mental clarity. Those symptoms are often attributed to aging itself rather than to a supplement that may be contributing. Another concern is that poorly absorbed magnesium does not necessarily provide the intended benefits for muscle relaxation or cardiovascular support. A senior may believe they are taking magnesium to prevent cramps or support heart rhythm, but if most of it is not being absorbed, the expected results may never appear. This can lead to increasing the dose without medical guidance, thinking the original amount was simply too low. Higher doses of magnesium oxide can amplify gastrointestinal side effects without significantly improving absorption. Kidney function is another important factor. While magnesium oxide itself is not inherently dangerous for healthy individuals, excess magnesium from any source must be filtered through the kidneys. As kidney efficiency naturally declines with age, the margin for error narrows. Although serious magnesium accumulation is uncommon in people with normal kidney function, seniors with reduced kidney capacity may be more vulnerable to imbalance if doses are not appropriate. Medication interactions also deserve attention. Magnesium can interfere with the absorption of certain antibiotics, thyroid medications, and osteoporosis drugs when taken at the same time. Because magnesium oxide is often taken casually without timing considerations, these interactions may go unnoticed. The key issue is not that magnesium oxide is universally harmful, but that it is often chosen without understanding its primary effect. Seniors seeking muscle support or sleep improvement may not realize they are primarily purchasing a laxative form. Without individualized assessment of health status, hydration levels, kidney function, and medication schedules, magnesium oxide may create more digestive disruption than real systemic benefit. Magnesium citrate is another form that many seniors encounter, often recommended for occasional constipation or included in over-the-counter digestive products. Compared to magnesium oxide, it is generally better absorbed, which makes it seem like a more attractive option. However, its strong osmotic effect in the intestines means it still pulls water into the bowel. That action can be helpful in short-term situations, but when taken regularly without supervision, it may create unintended consequences. For older adults, the balance between relieving constipation and maintaining proper hydration is delicate. Magnesium citrate increases bowel activity by drawing fluid into the digestive tract. If fluid intake does not increase accordingly, this can contribute to dehydration. After R and said, R5, the body's thirst signals are often weaker. Many seniors do not naturally drink enough water throughout the day. Adding a supplement that increases fluid loss through the stool can compound that issue. Dehydration in seniors does not always present dramatically. It can show up as fatigue, headaches, muscle weakness, or lightheadedness when standing. Blood pressure may drop slightly, increasing fall risk. In individuals already taking blood pressure medications or diuretics, the combined effect can be significant. A supplement that seems harmless may subtly amplify medication effects, especially if timing and dosage are not carefully managed. Another consideration is electrolyte balance. Magnesium works closely with sodium, potassium, and calcium. When bowel movements become more frequent, there can be minor shifts in these electrolytes. For most healthy individuals, the body corrects these changes efficiently. But in older adults with heart conditions, kidney concerns, or those taking medications that influence electrolyte levels, even small imbalances can matter. Magnesium citrate is sometimes chosen for its calming effect or potential support for muscle relaxation. While it can provide systemic magnesium more effectively than magnesium oxide, its laxative tendency remains prominent. Some seniors increase the dose hoping for improved sleep or reduced cramps, unaware that the digestive side effects may intensify before meaningful muscular benefits are achieved. Frequent loose stools can also reduce absorption of other nutrients, particularly if taken close to meals. Kidney function again plays a role. As filtration capacity declines with age, the body may not clear excess minerals as efficiently. Although moderate magnesium intake is generally safe for individuals with healthy kidneys, seniors with reduced function may need individualized dosing. This is especially important for those with chronic kidney disease or borderline lab values. Medication timing is another overlooked factor. Magnesium citrate can interfere with the absorption of certain antibiotics, thyroid medications, and bisphosphonates used for osteoporosis. If taken too close to these medications, it may reduce their effectiveness. The core issue is not that magnesium citrate is inherently unsafe. It is that its digestive strength and fluid shifting properties make it less suitable for daily unsupervised use in many older adults. What begins as a simple supplement choice can influence hydration, blood pressure stability, and medication balance in ways that are not immediately obvious, but can gradually impact overall well-being. Magnesium sulfate is a form many people recognize from Epsom salt baths, but it is also available in oral preparations and sometimes used medically for specific conditions. Because it has legitimate medical applications, some assume it must be safe for routine supplementation. However, magnesium sulfate behaves very differently in the body compared to forms designed for gradual nutritional support. When taken orally, magnesium sulfate has a powerful laxative effect. It draws water into the intestines rapidly and can cause significant bowel evacuation. In clinical settings, it is sometimes used short-term under supervision to clear the bowel. For seniors, especially those over 4 or 5, using a strong osmotic agent without medical guidance can create rapid fluid shifts. The body at this age does not adjust as quickly to sudden losses of water and electrolytes. Even mild dehydration in older adults can lead to dizziness, weakness, confusion, and increased fall risk. If magnesium sulfate is taken in higher amounts or more frequently than intended, the risk increases. Seniors who already take medications for blood pressure, heart rhythm, or fluid retention may be particularly sensitive to these changes. A supplement that seems like a simple solution for constipation can unintentionally disrupt stability. Another concern is systemic absorption. While magnesium sulfate is often used externally in baths for muscle relaxation, oral ingestion introduces magnesium directly into circulation. In individuals with reduced kidney function, excess magnesium may accumulate more easily. The kidneys are responsible for filtering and excreting surplus minerals. As kidney efficiency naturally declines with age, the margin for safe dosing narrows. Elevated magnesium levels can cause symptoms such as low blood pressure, slowed heart rate, muscle weakness, and, in severe cases, irregular heartbeat. Seniors are sometimes more vulnerable because kidney decline can be subtle. Lab values may appear only mildly reduced, yet the body's ability to handle large mineral loads may still be compromised. Without individualized medical evaluation, routine use of magnesium sulfate as a supplement can become risky, especially if doses are not carefully measured. Medication interactions must also be considered. Magnesium can interfere with the absorption of certain drugs if taken simultaneously. Antibiotics, thyroid medications, and osteoporosis treatments may bind with magnesium in the digestive tract, reducing their effectiveness. When magnesium sulfate is taken casually without spacing doses appropriately, these interactions may go unnoticed. There is also the misconception that because Epsom salt baths are common, ingesting magnesium sulfate is equally benign. Topical exposure does not carry the same systemic impact as oral intake. The digestive and renal systems are directly involved when magnesium sulfate is consumed, which changes the risk profile entirely. The broader issue is that magnesium sulfate is not typically intended as a daily nutritional supplement for seniors seeking gentle support. Its strong osmotic action and potential systemic effects make it better suited for short-term supervised use. Without proper guidance, what begins as an attempt to improve digestion or muscle comfort can place unnecessary strain on hydration balance, kidney function, and cardiovascular stability in an aging body. Magnesium aspartate is often marketed as a highly absorbable form of magnesium, and that claim is not entirely inaccurate. It tends to enter the bloodstream more efficiently than magnesium oxide, which makes it appealing to those looking for better systemic effects. However, the aspartate component attached to magnesium raises important considerations for seniors, especially when neurological and cardiovascular stability become more sensitive with age. Aspartate is a form of aspartic acid, an amino acid that functions as an excitatory neurotransmitter. In simple terms, it can stimulate nerve activity. While this may not be problematic for younger individuals with resilient nervous systems, older adults may respond differently. After 4 or 5, the nervous system is often more vulnerable to overstimulation. Sleep patterns may already be fragile. Anxiety may be more pronounced. Sensitivity to stimulatory compounds can increase. In certain individuals, magnesium aspartate may not provide the calming effect typically associated with magnesium. Instead, it may feel neutral or, in some cases, mildly activating. For seniors who are taking magnesium to support relaxation or improve sleep, this difference matters. A supplement that is expected to calm the body may not deliver the intended outcome if the accompanying compound has excitatory properties. While research on aspartate in supplement doses remains limited, the theoretical concern is enough that some clinicians prefer gentler forms for older patients. Another factor involves heart rhythm. Magnesium plays a crucial role in maintaining stable cardiac electrical activity. However, excitatory amino acids in high concentrations have been studied in relation to neurological and cardiovascular signaling. Although standard supplemental doses are not typically associated with severe risk in healthy individuals, seniors with pre-existing heart rhythm disorders or those taking medications that affect electrical conduction may wish to approach such forms cautiously and under medical supervision. Kidney function again influences safety. Highly absorbable magnesium means more intercirculation. In individuals with reduced kidney filtration, excess magnesium may accumulate if intake exceeds excretion capacity. Symptoms of elevated magnesium levels can include muscle weakness, slowed reflexes, low blood pressure, and changes in heart rhythm. These outcomes are uncommon at standard doses in healthy adults, but become more relevant when kidney efficiency declines. Medication timing remains critical. Like other magnesium forms, magnesium aspartate can bind to certain medications in the digestive tract, reducing absorption. Antibiotics, thyroid replacement therapy, and osteoporosis drugs are particularly sensitive. Seniors managing multiple prescriptions may not always be aware of the need to separate magnesium intake by several hours. The issue is not that magnesium aspartate is inherently dangerous. Rather, it combines high absorption with a compound that may not align with the calming, stabilizing goals many seniors have when supplementing. Individual sensitivity, neurological health, cardiovascular history, kidney function, and medication schedules all influence whether this form is appropriate. Without individualized evaluation, choosing a highly absorbable and potentially stimulatory form may not provide the predictable, gentle support that older adults often require. Magnesium carbonate is another form that occasionally appears in supplements, though it is more commonly found in antacids and digestive remedies. At first glance, it may seem harmless. It contains magnesium, and magnesium is widely associated with muscle and nerve support. However, magnesium carbonate behaves differently once it enters the body, and those differences matter more after 65 or 5. When magnesium carbonate reaches the stomach, it reacts with stomach acid and is converted into magnesium chloride. This reaction can reduce stomach acidity. While that may sound beneficial for someone dealing with occasional heartburn, stomach acid plays an important role in digestion and nutrient absorption. As people age, natural stomach acid production often declines. Further reducing acidity may interfere with proper digestion of proteins and absorption of nutrients such as vitamin B12, iron, and calcium. For seniors who already face higher risk of nutrient deficiencies, this can become a subtle but meaningful concern. Because magnesium carbonate is sometimes included in chewable tablets or powder forms, it may be taken casually without much thought about its broader digestive impact. Over time, frequent reduction of stomach acid can influence gut balance and digestion efficiency. Seniors may experience bloating, discomfort, or reduced appetite, assuming it is simply part of aging rather than a side effect of supplementation. Absorption of magnesium from carbonate form is moderate but variable. If stomach acid levels are already low, conversion to the absorbable form may be less efficient. This creates an unpredictable situation where some of the magnesium is absorbed while the remainder may contribute to mild laxative effects. In sensitive individuals, especially those prone to digestive irregularity, this inconsistency can be frustrating. Hydration and kidney function again play a role. As with all magnesium forms, excess intake must be filtered through the kidneys. Older adults with reduced kidney efficiency may need lower doses or medical monitoring. While magnesium carbonate is not among the most aggressive forms, taking higher than needed amounts in pursuit of muscle relaxation or sleep improvement can create unnecessary strain. Another overlooked issue involves medication interactions. Seniors frequently take medications for osteoporosis, thyroid function, blood pressure, or heart rhythm. Magnesium in any form can interfere with absorption of certain drugs if taken simultaneously. Because magnesium carbonate is sometimes marketed as an antacid, individuals may take it near meals or medications, unintentionally affecting how those prescriptions work. The core challenge with magnesium carbonate is that it serves a dual purpose. It functions both as a magnesium source and as an acid neutralizing compound. For seniors who already have altered digestion patterns, adding a supplement that modifies stomach acidity without medical guidance may complicate rather than simplify health management. What appears to be a gentle mineral supplement may subtly influence digestion, nutrient absorption, and medication effectiveness in ways that are not immediately obvious, but become more relevant with advancing age. Magnesium can absolutely be helpful for many seniors, but the form, the dose, the timing, and your individual health status all matter more than most supplement labels suggest. After 60, or 5, the body does not process minerals the same way it did decades earlier. Kidney function may be slower, stomach acid may be lower, medication lists may be longer. What seems like a simple over-the-counter supplement can interact with hydration levels, blood pressure, digestion, or prescription drugs in subtle ways. The goal is not to avoid magnesium entirely. The goal is to avoid taking it blindly. Before starting or continuing any magnesium supplement, it's wise to consider your kidney function, your current medication,
your digestive sensitivity,
your reason for taking magnesium in the first place. Sometimes the safest choice is a different form. Sometimes it's a lower dose. Sometimes it's spacing it away from other medications. And sometimes it may not be necessary at all if levels are already adequate. The most important takeaway is awareness. Supplements are powerful tools, but they are not one-size-fits-all solutions. Especially after 5 small details can make a meaningful difference. Your health deserves informed decisions, not guesswork. Always discuss supplement changes with your healthcare provider, particularly if you have kidney concerns, heart conditions, or take prescription medications. A 5-minute conversation could prevent months of avoidable symptoms and help ensure that what you're taking truly supports your long-term well-being